Welcome everyone to our third Lesson from the Field webinar. Today we're very happy to have Judy Thibodeau here to present with us. Judy joined the Spina Bifida Association in 2018 as Director of Research and Services. Prior to that, for 13 years, she coordinated the National Spina Bifida Program at the Center for Disease Control and Prevention, during which time the National Spina Bifida Patient Registry was created and implemented. She's been involved in the care of people living with spina bifida, as well as in research to improve that care for 40 years. This work has included collaborating in the development of an independence enhancement program for children with spina bifida, the Spina Bifida Habilitation Program at the Shepherd Center, and working with Emory University Pediatric Urology in Atlanta, Georgia. So Judy, thanks so much for being here. We're happy to have you, and please feel free to take it away.
Thank you, Matthew. It's a pleasure to share with you how the Spina Bifida Association developed a community-centered Spina Bifida Research Agenda. In 2018, the Spina Bifida Association, which I'm going to now say SBA because it's a long word to say over and over, updated and actually added to the guidelines for the care of people with spina bifida. And part of that process was to identify research gaps in the care that was needed, and there were many. So SBA took those research gaps and wanted to know, in light of, we knew what the clinicians felt the gaps were and what the research literature said, what did people with spina bifida think was important to living with spina bifida? So we conducted a quantitative survey in May of 20, I think that says 19, I can't really say it, yeah, among adults with spina bifida and parents of children with spina bifida. And we know now, today, there are more adults living in the United States with spina bifida than children. So this quantitative survey was based on the research gaps that were identified in the 2018 update of our guidelines. So it was an online survey conducted by SurveyMonkey in April, May 2019. We mailed the survey to our database of approximately 20,000 people. And I want to say, in case somebody asks me, our database is not a clean database, so we don't know, we can't really identify who are parents, who are children, which has been a frustration to the market researcher who helped us do this. But that's just putting that out there. Our database is in need of some fixing. We also posted the survey on our Facebook pages. We offered the survey in English and Spanish. We actually received no responses in Spanish. That's also been asked of us. We received over 1,700 responses. There were 1,600 respondents who were qualified. And this was parents of children under and over 18, adults with spina bifida, and caregivers of persons with spina bifida. After the survey, we conducted 2 focus groups to help us understand the results in the survey. And this was also with parents of children with spina bifida and adults with spina bifida. The research gaps that were identified as part of the development of the guidelines had to be reworded into language that was relevant to living with spina bifida. So these were the 27 items and topics that were evaluated in the survey. And the question we asked for each item is, how much of an issue is the item? Was it a very big issue or not an issue at all? And we ask a last question to choose up to 5 items from the list below that are the biggest issues or concerns you have about living with spina bifida. So we asked them question by question, then we said, give us out of this list, what are the most important issues to you? So these are the top biggest issues and problems that were identified based on the parents of a young child, parents of an older child, and adults with spina bifida. And you can see there's many similarities in the 3 lists. This allowed us to look at the research gaps that came from the development of the guidelines, the research priorities of people with spina bifida, the results of this survey and focus groups, And we know research that can be done with the National Spina Bifida Patient Registry, which is a registry that is managed at the Centers for Disease Control, and one that we advocated for and provided the funding to CDC. Congress provided the funding. We advocated for it, for this registry, which has been in place for now over 10 years and has more than 10,000 people in the registry, both adults and children. So you can see in the red language, high priority research, the research that's important to parents or important to the people with spina bifida, related to the healthcare gaps identified, and can be done with the registry, because that really gives us some low-hanging fruit. So in summary, how we got to where we are now, we have the healthcare guidelines that were updated and launched in 2018. They identified research gaps, over 250 research gaps. The gaps were shared with the community in a more community-based language in the spring of 19. Focus groups were conducted to continue to clarify what was important to adults with spina bifida and parents of children with spina bifida. And we formed a research advisory council in March of 20, following all of this work, to address the 6 areas of importance. And the research council includes, is still in working now, a mix of parents of children with spina bifida, adults with spina bifida, and healthcare professionals with spina bifida expertise. And people competed to be on this in this work council. So we had like 30 something applicants, and we chose a group of 18 folks. So these are the 6 important areas of impact for people living with spina bifida: bowel continence, mental health, self-management, transition, urinary continence, and weight management and nutrition. Each research advisory council topic group identified 10 to 12 research questions that they perceived as most important or in need of research in each of those 6 areas. And remember, these is a group of parents and adults and researchers and clinicians. After these research questions were identified, SBA conducted 12 virtual discussion groups, 2 for each of the 6 topics, between October 2020 and April of 21, to clarify the research questions and identify the most important questions. We were looking for approximately 5 questions per topic, and we wanted the community to guide us in what those were. I'm going to show you just examples. This is the bowel continence research statements, and on the left are the original research questions. You can see there were 12 people that participated in this discussion group. There are these 2 discussion groups. And then they ranked, the adults ranked and the parents ranked the questions, again, on the left, that were most important to them. They also guided us on what about the research question they didn't understand. I'm going to share that with you in a moment. So the questions on the right are the statements that we are going to use moving forward that are more community friendly. And this has been a very important learning to us. And remember, we had parents and adults working with us to identify the research questions. We still had a lack of clarity on what the questions meant. Same thing for weight management. And you can see their votes differed. Parents might have voted more for a question because it affected them more than the adults, and vice versa. And these are the urinary continence research questions. We actually changed our questions into statements after the first session, because we learned that when we asked these discussion groups the question, they wanted to answer the question. And we wanted them to help clarify the question and make it more meaningful for the community, or tell us what didn't make sense to them, or items in it that were give them a negative response. And our transition research questions, you see some of the groups had 3 questions, some had 6, because we cut off the questions out of the 12 when 50%, less than 50% of the people prioritized them. Mental health, have learned, and you probably know, is a really important issue for people with chronic conditions, and a condition like spina bifida that began at birth, before birth. So mental health has a lot of questions that were identified as important to both adults and parents. So our next steps are to hold a research workshop on November the 6th. It'll be virtual and free. And we are doing this to launch the research agenda in a very broad community and stimulate interest in the topics and look for collaborations. This is being marketed broadly now to NIH researchers, clinicians, researchers that we know who've asked us to support their research, and professional organizations. So we learned a lot about what we call communication pearls when we talk to our community, and we've captured these pearls and shared them with our staff at SBA, so that we learn language that's not understandable or is not preferred in our community. And here are some of and these could have come from one person or multiple people, but clinical factors was meaningless to some people. What are modifiable factors? What does improved bowel continence mean? What is meant by colorectal health? They understood bowel health, but not colorectal. When you hear this, this makes sense, and yet we actually didn't modify the research questions before they went to the community from the Research Advisory Council. They asked us to include transportation and a list of barriers to exercise, to refer to caregivers and parents, use the word lifestyle instead of habits, and instead of compliance, should say more likely to do it. They asked, what is meant by measurement tools? They think looking for a successful life is being assumptive, and because everybody's not successful regardless of if they have a condition like spina bifida. Define family navigator, what are transition services? These are things that we now incorporate into the language we use when we reach out to our community. So what we've done in summary, we've considered the research gaps identified when the guidelines for the care of people with spina bifida were developed. We've identified the most impactful issues for people living with spina bifida through the process that I've just described. We've learned about language that's preferred and understandable for our community. And we continue to work with the SBA Research Advisory Council, so we have the community's influence on anything we do in research or how we share information about research, how we interpret research, to consider how it affects our community. Again, we'll have a research workshop on November 6th. Dr. Brad DiCiano will facilitate that. The CDC will be involved with us so that the National Spina Bifida Patient Registry questions can be considered when researchers consider the topics of interest. Research Advisory Council members will present the research questions in the area in which they worked. There will be parents and adults involved in research discussion groups, so we stay true to what the questions mean and how parents and adults feel about the questions. We intend and hope to build collaboration among researchers around specific questions, and then work together with those researchers to identify funding opportunities so that we can support the development of the research that's important to the community. And I thank you for this opportunity.
Well, thank you so much, Judy. We very much appreciate your presentation and coming here today. I see we had Allison join. Allison, do you have any questions for our presenter? We'll give her a second, but I will take that as a no. Judy, any follow-up comments or things just that you'd like to follow up in the presentation? All right, looks like no questions for Allison. Wonderful.
No.
Yeah.
Well, we think this process is really important, and we're glad to share it. We were lucky to have a volunteer market researcher who's guided this process from the beginning. Once the guidelines were developed, gaps were identified, then she has helped us to get to where we've gotten, and we feel strongly about that the process has been true to reflect the desires and needs of the community. And we're hopeful that research will result around these issues. So again, thank you, and I appreciate the opportunity.